Imagine a sneaky animal that hunts without being seen, similar to a story from a mystery book. But this is what happens to people with pancreatic diseases. These diseases are hard to notice until they are very serious, which makes them a big problem for doctors. The pancreas is an important organ that helps with digestion and keeping blood sugar levels normal. It can get sick with issues like pancreatitis, pancreatic cancer, and diabetes. These problems slowly get worse without showing many signs at first because the pancreas is hidden deep in the belly. It's very important to learn about and notice the early signs of pancreatic diseases. Doing so can help get the right treatment early and save lives. Looking into pancreatic diseases shows us how important it is to spot symptoms early, which could save lives. Even though the pancreas is small, it has a big job in helping digest food and control blood sugar levels. Diseases like pancreatitis, pancreatic cancer, and diabetes can get worse without any clear early symptoms, making them hard to find early on. Catching these diseases early is crucial because it means better treatment choices and results. Early detection can lead to less harsh surgeries, specific treatments, and plans to manage the disease. This can make a big difference in how well someone feels and how long they live, especially if they have pancreatic cancer. Finding out about pancreatic diseases late usually means there are fewer ways to treat them. Instead, doctors focus on making the person feel better and improving their life. This late discovery greatly affects how long people can live, with those found early having a much better chance of living longer than 5 years compared to those found late. But, if more people know about these diseases and catch them early, the story can change. Better treatments and more hopeful results can become possible. Teaching people, spreading the word, and taking charge of our health early are important steps to change the future for those with pancreatic diseases. It's really important to know the early signs and get help right away. Number 1, abdominal pain. Never ignore belly pain. It's often the first hint that something might be wrong with your pancreas. This isn't just a little ache, it's a specific kind of pain that can tell doctors it might be coming from your pancreas. Let's understand more about this symptom. The pain from pancreatic diseases usually starts in the upper part of your belly. It's a very specific kind of pain. Often, it feels very deep, like it's drilling through your back. Many people say the pain is dull and achy, gets worse after eating, especially fatty foods, or when lying down. These signs suggest the pancreas is involved. Why does this pain happen? The pancreas sits in the upper belly, behind the stomach, close to other big organs near the spine. When there's inflammation, like in pancreatitis, or a growth pushing on nearby tissues, it causes the distinct pain we talked about. This inflammation or pressure also messes up the flow of digestive enzymes and bile, causing more discomfort or even complications. This pain is crucial for several reasons. First, it can warn us early on, leading to quicker checks and treatment. Early action can greatly improve outcomes for pancreatic diseases, offering better treatment options and sometimes even a cure. Recognizing the specific type of belly pain linked to the pancreas is important for health awareness. If the pain keeps up, or if you also have signs like yellowing skin, jaundice, or unexplained weight loss, it's especially important to pay attention. I don't want to scare anyone, but I do want to stress the importance of being proactive about your health. Paying attention to what your body is telling you and acting on it is key. Number 2, jaundice. Jaundice is like a big, bright warning sign that something might be wrong with your pancreas, liver, or bile ducts. It's more of an alert than just a symptom, shining a spotlight on possible trouble inside your body. Let's dive into why jaundice is so important when we're talking about the health of your pancreas. You can tell someone has jaundice because their skin and the whites of their eyes turn yellow. This happens when bilirubin, a yellow substance that comes from the normal breakdown of red blood cells, builds up in the blood. Usually, bilirubin gets processed in the liver and then leaves the body. But if this process gets messed up, bilirubin levels go up, and you see jaundice. Pancreatic diseases can mess with this process in a few ways. For example, if there's a tumor in the pancreas, it might get big enough to block the bile duct. This means bilirubin can't get out like it should, leading to jaundice. This blockage is a common reason for jaundice in people with pancreatic cancer. Also, if the pancreas is inflamed, it can affect how the liver works, including how bile flows, which might also lead to jaundice. The role of jaundice in spotting pancreatic diseases is really important. It's like an early alarm that could point to something serious, like pancreatic cancer. If you notice jaundice, belly pain, or unexplained weight loss, it's important to get medical help right away. Number 3. Unexplained weight loss. Unexplained weight loss is a symptom that can't be overlooked and checking for signs of pancreatic diseases. It's a kind of weight loss that happens suddenly, without dieting or exercise, and it's a big warning sign. Let's talk about why unexpected weight loss happens with pancreatic diseases and why it's important to pay attention if this symptom appears. For some, losing weight without trying might seem like a lucky break. But actually, it's a serious warning sign about your health. Unexplained weight loss is especially concerning with pancreatic diseases because the pancreas is key to digestion and absorbing nutrients. It makes enzymes that are crucial for breaking down food. When there's a problem, like pancreatic cancer or pancreatitis, these enzymes don't work right, leading to malabsorption and weight loss. Problems with the pancreas can also make you lose your appetite or not use glucose efficiently, causing weight loss. For example, a tumor in the pancreas might press on the stomach, making you feel full or nauseous. Or, diabetes related to pancreatic issues can prevent your body from using glucose properly for energy. Unexplained weight loss is more than just losing pounds, it's a major clue that something serious, like pancreatic cancer, might be going on. Recognizing this symptom and getting medical help quickly is crucial. It can lead to tests and checks that find out what's wrong. Unexplained weight loss is a serious sign. If you're losing weight without trying, you should talk to a doctor to find out why. Number 4. Changes in stool color. Changing the color of your poop is a sign you shouldn't ignore because it might tell you there's something wrong with your pancreas. Even though people don't often talk about what their poop looks like, it's really important to pay attention to changes. These changes could be a sign of health problems, including those affecting the pancreas. Let's dive deeper into this symptom. Usually, bile, which is a digestive fluid from the liver, gives your poop a consistent brown color because it helps digest fats. But, if you have pancreatic issues like pancreatic cancer or pancreatitis, the process that lets bile get into your intestines might be blocked. One big sign is when your poop turns pale, clay-colored, or even light yellow. This happens because pancreatic problems can block the bile ducts, stopping bile from coloring the poop. So, without bile doing its job, the poop looks much lighter when it comes out. You might also notice your poop looks greasy or has an oil slick on it, along with a really bad smell. This means fats in your food aren't being digested or absorbed right, pointing to a problem with the pancreatic enzymes. These changes are red flags for pancreatic diseases and could lead to more serious issues if not taken care of. If your poop changes color and it's not because of what you ate, especially if you also have belly pain, jaundice, or are losing weight without trying, it's time to see a doctor. Any change in poop color, even if it doesn't last long, should be taken seriously. Number 5. New-onset diabetes. Exploring early warning signs of pancreatic diseases, we can't overlook a very important symptom that has recently gained attention: new-onset diabetes, which is especially concerning. Unlike type 1 or type 2 diabetes, which are often due to genetics or lifestyle choices, new-onset diabetes in adults might hint at different underlying conditions, including pancreatic cancer. New-onset diabetes happens when the pancreas, the organ responsible for regulating blood sugar by producing insulin, starts to fail. This could be due to a tumor in the pancreas or inflammation causing the organ to malfunction. It's particularly notable when someone without typical risk factors for type 2 diabetes, like being overweight or having a family history of the disease, suddenly develops diabetes. The link between new-onset diabetes and pancreatic diseases, especially pancreatic cancer, is an area of growing research. It's been found that in about 25% of pancreatic cancer cases, one of the first signs is this kind of diabetes. The symptoms can be subtle, like increased thirst and urination, unexplained weight loss, and fatigue. These could easily be mistaken for minor health issues, but they may actually be early indicators of a serious pancreatic condition. This connection between new-onset diabetes and pancreatic problems is crucial. It suggests that new-onset diabetes, especially in those over 50 who suddenly develop diabetes without the usual risk factors, should prompt further investigation for pancreatic diseases. Recognizing this link early on could be key to diagnosing and treating underlying pancreatic conditions more effectively, potentially changing the prognosis for many people. As we wrap up our exploration of the early signs of pancreatic disorders, we've highlighted several critical symptoms to watch out for: belly pain, yellowing skin, jaundice, unexplained weight loss, changes in the color of stool, and sudden diabetes onset. Though these signs might be easy to overlook, they are important clues that could point to problems with the pancreas, including pancreatic cancer. The pancreas is essential for digestion and regulating our body's sugar levels, but it tends to signal trouble in subtle ways. This makes spotting problems early a challenge, yet it's incredibly important for catching diseases before they advance. Taking note of these symptoms early and getting advice from a healthcare provider can make a big difference, possibly saving lives. This is a call to everyone to pay close attention to what our bodies are telling us and to seek medical help without delay. Being aware and proactive about our health is crucial to fighting pancreatic diseases. By being alert to these early warning signs and acting quickly, we give ourselves and our loved ones a better chance to tackle pancreatic diseases with early detection and treatment.